everybody, welcome to today's video. We're really excited to be here with Dr. Sarah Pedersen from Motion Equine. We just wanted to do a little bit of an intro on both in-hand equine therapy and Motion Equine. Dr. Sarah and I have been working together for quite a while, and we've had some really fun cases together. So we're super excited that this is coming together today. So Sarah, do you want to tell us a little bit about your history and why you got into being a veterinarian?
Sure. So I think like a lot of people, I grew up riding ponies, pony club, like many people, always wanted to be a veterinarian and was lucky enough to achieve that, so that was awesome. And then as I progressed through my practice and my career, I was struggling with those difficult to solve cases, mystery cases, just not doing right, that type of thing, which kind of led me down the rehab type route. So that's kind of how we met, right?
Yeah, totally, totally. And I always say to people that if you can't figure something out, Dr. Sarah's the one to call, because she is a good investigator of things. So I love that. I love that. And so what is Motion Equine all about? Why did you start Motion?
So Motion is really the culmination of all of those things that we just chatted about. So regular veterinary work, but also performance assessment, chiropractic, acupuncture, rehabilitation, really an integrative approach to equine medicine and equine performance.
Cool.
And part of that integration is, of course, the body work. So.
Right. And that's where it comes together so well with in-hand equine, because we're always trying to figure out what could that next level be. How could that horse be that much better? And I also really like to be able to work with people that really want to be able to work back and forth and take that horse and not just go, oh, he's fine as he is, but try to see where we can get to that next level, bring the performance that much better, but also the relationship with the horse and rider that much better. Because I think when the horse feels good, then the horse can do what the rider wants it to do. When you're working on horses, Dr. Sarah, what are you looking at? What's your first thing when you come to see a new horse?
A new horse. So the first thing that I look at is I ask them to leave the horse standing in the stall all the cross ties. So I'll look at them what I call statically or stationary, so the static exam. And then we chat a little bit about what the horse does, what the horse's job is, what the rider's goals and expectations are, what the problem is, why am I here today? And then we watch them move and assess. So it really is a very global look at the horses and how they're doing.
Fantastic. And same for us when we're looking at bodywork things. We really want to look at the horse holistically to try to understand what those underlying things are. I think as well, when you have a team approach, like Dr. Sarah and I have, and as well Kim Krebs that works for In-Hand Equine, when we're talking about a horse, it really allows us then to see the horse through a second set of glasses, which I think is something that we want to just talk a little bit about here in the intro. What does it mean to you, Dr. Sarah, when you have somebody else's, not just their opinion, but also their overall outlook? What does it bring to you as a practitioner?
So for sure, it makes me definitely reassess what I'm looking at. So for example, if I get some feedback from you that there's some concern in the horse's tissue, we can look into why that is. Or maybe you're concerned about a posture thing that you've seen, we'll look at that. Or maybe they're concerned about the horses being ridden in a specific way, or maybe we're concerned about saddle fit. So all of those things go into my assessment as well.
Cool. So I think that's really important when you guys are looking at your own horses, if you're a horse owner, or if you're a body worker or another professional. I think it's really important to start to build these team members within your practice to really be able to have you excel and understand things at a much deeper level.
Yeah, and I always tell people, you know, I can learn from anybody, so any information can be useful. And so that's something to keep in mind as well.
Totally.
We wanted to chat to you today, given the current climate, about where your horse is at and coming safely back into work with some of the restrictions being lifted.
Yeah, I think it's really easy for all of us to kind of feel like, all right, we've got our chance to get back on our horse and I haven't ridden it for 6-8 weeks,
right.
and I just want to get back on where I was. And I think we need to really talk about why that would be a bad idea and what could happen to the tissue. Because unfortunately for horses, they want to please us.
Absolutely.
They, you know, if we ask them to do something, they're going to try their best to get it done.
Absolutely.
And lots of times with a fitness problem, if you do get some micro tears or an injury from that, it might not show up for a couple months down the road.
3-6 months, right.
Yeah, so tell us about that, Doc. How does that work?
So, I guess let me step back first. So myself and Tina and Kim were chatting, and we're all a little concerned, and that was why we chose to do this video today, that we want to make sure that everybody does this safely and recognizing that all the horses are at different levels. Some horses may have been in work with a trainer, which is excellent. They may be in better condition. Some horses may have had 6 weeks off and may need to be brought back into work differently or more slowly. So we wanted to really make it clear that it's important to do an assessment and help you do that.
Yeah,
right?
Totally.
So like Tina was expressing earlier, it may not be a week or 2 weeks that we see the problem, but we may see that 3 months or 6 months down the road, which is when we're hopeful that we're all going to be back competing and enjoying the horses.
Yes, exactly. So when you do an assessment, we really want to look at the horse, and we're going to bring a live horse in to do that assessment. But I think Dr. Pedersen's point is very important, that when you get back to the barn to see your horse, you really do that self-assessment yourself to decide where you're at, and then decide if you need a professional to come in and do some more assessment.
And that's really what we're hoping to help you with today is we were talking about, we kind of talked about making lemons out of lemonade, and let's use this time to stop, assess, reflect, and kind of come back better, if you like.
Yeah. And it's a great time. I like how Dr. Pedersen said that we should maybe think to ourselves that this is a chance to reset.
Right.
Really look at, like she said, areas that were weak, and maybe during show seasons of the past, we haven't had the chance to be able to really get something fixed or stronger that we've really never had strong on the particular horse we're looking at. So great chance to actually look and see maybe we could make this horse better. And
absolutely.
If there is some fall shows, you know, be able to excel at a different level than you were able to before.
Right. So in talking, we came up with a checklist for you. So I think we're going to talk a little bit about that.
Our first point on our checklist today is going to be to look at your horse's overall posture. This is going to be something that a lot of horse owners really forget about because you see your horse every day and we're so used to being around it, we forget to look at it with that discerning eye to really be able to see what's happening with your horse. Whenever I look for posture, I'm going to look at the overall shape of the top line and the overall shape of the underside. I want to just see if there's something that has some obvious dips, some obvious holes, some place where the body is not holding theirself in an athletic shape. If we are able to look for these areas, you're going to get an idea then of where your horse is either tight or weak. Dr. Sarah, is there anything that you look for when you're looking for posture on a horse?
So I definitely look at if they choose to stand squarely, if they always have one particular foot forward or back. I also look at head and neck position, and you saw me giving our model here some cookies. I like to see how they reach with their neck as well. So that's what I would add for that.
So when you're looking at your horse's posture, you would also like to be able to look at this time as a great opportunity to take a complete reset. So if your horse has had something that you've been working on for a long time, it might be a chance to actually step back, because we're not going to be having shows or clinics for the next few months, and really be able to target that area for strength. If we then could change that overall posture, we would be able to look at the horse not only in a more athletic frame, but they would use themselves more efficiently and allow them to be sounder longer.
Right. Something that I like to do when I assess horses, and I think we can all do as we come back into this, is tell me about your horse. What's your horse's story? So I would ask a client, tell me about a day in the life of your horse.
Right.
So some things that I might get are, what's your horse eating? Does he get turned out? Is he turned out for an hour? Is he turned out in a 40-acre pasture? Has that changed in the last few weeks?
Yeah.
So I think it's really important to assess what your horse's long-term story was and what the short-term now story is, and is that going to change in the next little bit?
Yeah, totally. And then I think as well, it's really important, and I love, you always say this to me, Doc, when you come out, you just say, so not only what's changed, but what would you want them to look forward to?
Right.
And then how could that change the horse's story, right?
Right. And something I get really commonly, and I think we can use this, you talked about that earlier, use this time to reset, is people will say, well, he moves left, but that's just him. And I don't, maybe it is, but maybe it isn't.
Yeah.
So let's use this time to reset and really do that evaluation.
Yeah. So I think the other thing to consider when you're looking at your horse's condition is the workload that you were in before versus the workload that you're going to come back to. When you bring your horse back, depending on what it did while you were off, or it was off, you're going to have to look at not only bringing back the level of wind, which of course is the recovery of the respiration, we also need to, though, look at what the muscle tissue is going to be able to sustain in workload. So it's not that you just have to back off, it's also that you have to assess what the horse is moving like, and maybe there's some areas of the body that really atrophied, especially if the horse had to stand in a stall more than usual with less barn staff. We really have to be able to evaluate all aspects of the horse.
So the next part of our assessment checklist is movement. So again, it's sometimes hard to take a step back and look at our horses, but it's really important after this little break to do that. So we're going to have a look at footfalls, we're going to have a look at overall movement away from us, movement towards us, and kind of see what information we can ascertain from that. So when we're watching the horse walk, I want to watch how high they pick up their feet, the line of symmetry that they're walking on, so if the hoofs are falling outside or inside of a center line. I'm watching the sway of the tail. I'm watching how the horse is able to turn around. I'm watching for any obvious signs of lameness or asymmetry in the muscles. And we're going to show you a really neat way to do that. If you don't feel comfortable watching your horse. Okay, so really simple way to assess your horse's movement. We just have a little strip here that we're just going to really quickly rake out any footfalls from previously. And then we're just going to walk the horse right down this newly raked area and have a look at where the hoofs fall. So we'll have a look at where these hoofs fell in the sand now. So you can see, we can really clearly see the footprints on our newly raked track, and you can see in this particular set of footprints, so this would be the left-hand side of the horse, you can see that our back foot has just slightly overstepped into our front foot. That's what we call overtracking, and that's pretty normal. The right step before that, you can see that we have a big overtrack. Now, we don't want to read too much into that on one set of footprints, but if you look over the whole length of your track, you can look for patterns, and if there are obvious repeatable asymmetries in those footfalls, that might be something to consider. And so the other thing to remember is if you don't have access to an arena, you can always just wet their feet and walk them on a driveway. That works too. For those of you that may be at the barn at your own or social distancing, just set your cell phone up and take a video of your horse and you, and that can be really helpful to watch a video, and sometimes it can be really helpful to watch a slow motion video as well. So there's lots of ways that you can assess your horse's movement even if you are practicing social distancing still and can't be around other people. So now we're going to look at our horse trotting, and so trot is a symmetrical pace, and so we can look at them from the side and from the front and from behind and just see if there's any, again, obvious asymmetries in the gait. So the last sort of component is, I think, the one that we traditionally think of as fitness, and it's not that it's not important, it's a component for sure, and that's cardiovascular fitness, so where are your horse's heart and lungs at? And so as they're walking, you can look for the respiratory rate, so you can either look at the abdomen and the diaphragm excursions or watch the nostril flares. Either one of those is just fine. And then also taking their pulse, so we'll just grab her here and have a look. And so that's the simplest way to do that, is if you run your hand on the inside part of their cheekbone, or the round part of the cheekbone, just under here is a good place to take their pulse. So you can monitor their pulse after 5 or 10 minutes of exercise and just get yourself a baseline.
One of the other important factors I feel very strongly about is goal setting. Goal setting for both you as a rider, but also for your horse. And obviously this is a crazy year in that most people's goals they had set at the beginning of the year are not going to be fulfilled at all. Totally. Just like you and Dr. Pedersen talked about earlier in regards to being able to take this year as a little bit of a reset and make the lemonade out of the lemons that were being dealt, in that this is a great opportunity to readjust those goals and look at this as a way to come back even stronger.
I think that's a great point, Kim, and I think the other thing that we could look at is maybe goals could be different this year. Maybe we've had a horse that is weak in an area, and we know they're weak in the area, being the rider, but we've just never really had the opportunity to look into that area. And maybe you could address one of your team members, your wellness team members that you use for your horse, and really look at redoing the goals to be maybe stronger than this horse has ever been before.
Absolutely, and that is a great segue into being able to look at this whole fitness program as a holistic approach, and making sure that if we have the time on our hands and we have the ability to work with our horses on a more regular basis, if we're not involved in such hectic lives anymore, that here's the opportunity to really concentrate and bring that horse back to its peak.
Yeah, full potential.
Yeah.
The other thing I think that we could look at as well is some of the barns as they're opening back up. Now, if you're lucky to have your horse at home, that's one thing. But some of the barns that are opening up, you only have a very limited time frame that you're with your horse. So maybe some of the exercises and things you need to be doing need to be quite targeted to allow some of the goals that you're going to set to be able to be accomplished.
Great point. I think time frame is super important when you're dealing with goal setting, and that's not something that is available to everybody, like you said, randomly. If you don't have your horse at home, you certainly are going to have to set up a time frame and know what your goals are on a daily level, but then also long term. So if you are into a performance sport and you're wanting to get back to that, we want to have that horse ready at a baseline fitness level, so when things are able to get rolling once again fully, then you can just step up that game and get right back into your sport.
Totally. And I think the other thing we forget about a lot when we're in sports-specific training is we forget about that cross-training aspect that maybe could be added into your goal list this spring and summer, not being able to get right back into the show ring. Maybe we could look at some exercises or some movements that we could do to really cross-train. And again, look at bringing your horse through this as a better performance animal than just sticking with your exact same protocol, your sports-specific exercise regime that you do every day. Maybe we could add in some cross-training or look at things that you've never had time to add in with your horse before.